I'm going to take you through what's called the sphenoid release, how I sometimes work on myself to help kind of shift some of the bones in the skull, help give some release of any tension in that area, and just help all my cranial nerves and everything to function a little bit better. So this pairs well if you do the frontal lift first. So if you haven't, or what I'll normally do is I'll do the frontal lift before I do the sphenoid release. So if you are trying this on yourself, if you want to look at the frontal lift video first, make sure you know that one if you're going to be trying these for yourself. So with this sphenoid release, before we were using our knuckle of our index finger. Now I'm just going to use the finger itself. And instead of being right here on the bone on the outside of the eyes, I'm going to feel that tender area right beside the eyes. They come in there, sit nice and tall, close the eyes, and remember really gentle pressure here. So still that like nickel to a quarter of pressure. Just gently sink into that meatier part, and then ever so gently giving some forward pressure. Breathing, giving some focus to the middle part of the head, just looking to have any kind of release through there. Continuing to sit tall through the spine, pulling the chin in gently. Breathe in through the nose and out through the mouth. A couple more breaths. And relax. And again, I can do it one time, a couple of times, hold for about 20 seconds, maybe upwards of a minute. Just any time that I start to feel some relaxation in that area or it feels like that's enough for now, then I release. So stay delicate. If you try this on yourself, never forcing anything in this area. This is where we want to really emphasize that less is more and just invite the body to reset for itself. The sphenoid bone is this butterfly-shaped bone that sits in the center of your head, and it's connected to nearly every other bone in our skull with the exceptions of the mandible, which is your jaw, the nasal bones that live in your nose, and the lacrimal bones that live in the tear ducts. So basically anything that's going on with the head, if there's any kind of trauma or injury, that can impact this sphenoid bone and cause extra pressure there. Also, it's going to help the majority of the cranial nerves, being that they run through all the different bones of the skull. And being that how it's positioned, it's best to do the frontal lift first to open up the space and then do the sphenoid decompression for the best results.